much, sir. One more thing that I want to mention, because we gave an allowance for the for certain MSAs to join via two different devices, we'll be very
Yes.
strict with monitoring malpractice. And for that, I want to tell every MSA to please ensure that all your participants' faces and upper bodies are visible. We need to make sure that your hands in particular are visible while you are answering your questions.
That's true.
It's I can't say that that's a hard and fast rule, but I can tell you for sure that it will prevent any allegations of malpractice. That's the last. Okay, thank you for raising your hand, Tamsa. Well, it will prevent any allegations of malpractice. That's the easiest way to do that. So now we have a monitoring officer here who will give more information about that. Mr. Ibekwe, I'm unmuting you now. So yes, please, you can introduce yourself and your role to the participants. Thank you.
All right, Miss Miracle, thank you very much. Once again, everyone, good morning and welcome to this quiz competition. My name is Ibekwe Jonas, and I'll be serving as the monitoring official for this quiz today. So I'll just like to highlight please, for the sake of this quiz and also to monitor the progress and then the answers coming in. And I would love everyone to actually rename their names on this Zoom link. So please, if you're a participant, kindly use your name and then your university, your medical student association. And then if you're part of the officiating team for this um quiz competition, please also rename and indicate your position. Okay, that way we can keep track and ensure there is no third party or something giving answers and all that. Thank you very much. So please, if you're not renamed, if you don't rename your device, you will likely be removed from this meeting. Okay. I still can see many unrenamed names. And please, I'll repeat this again. Kindly endeavor to rename your device. Everyone, both participants and the members of the officiating team. Your name and then your position for this quiz competition.
All right, thank you very much, Mr. Ibekwe. Again, please do that, because in 5 minutes, when we will be starting the quiz, everyone without a definite indication of their role in this place will be removed from the meeting. So thank you again, everyone, for joining, and thanks to our officials for today. So now that the instructions have been read, and I believe that they are clear to to all the participants, I'll be moving on to our questions. I think we have some. Mr. Quizmaster, can you please mute one of your devices so that we don't have that echo? Oh, okay, great. Thank you very much, sir. So I have the questions for our first section already. So if you're ready, sir, we can start from here, or you can reshare the document from your end if you prefer that, sir.
Yeah, we don't start.
Hello, sir. Can you hear me? Would you like to reshare the questions from your end, or can we start with this current sharing, sir?
Okay, well done, Miracle, moderator. I think before we go ahead, can we have a roll call to know the MSCs that are around? A quick roll call so we can dismiss those that are not meant to be there.
Okay, thank you very much. Do we have a recorder here to take the roll call? Otherwise, I'll just go ahead to do. Okay, I think I'll take the roll call myself then. If everyone can hear me clearly, Ugandan Christian Medical Universities Association, please just use the raise hand feature to indicate that your MSA is present. So that's what we'll be doing. So okay, so I just got a request from one of the participants from MSA. Unfortunately, we need to see you. That's Dorcas Okeke. Oh, okay. Okay, you're visible. All right. And she's asking if she can type her answers in the chat box. Yes, but we'll need to but again, there will be very, very strict monitoring for that. I just want to reiterate that. So yes, UCUMSA, Ugandan Christian University Medical Students Association. Are you in? Can you please use the raise hand feature? All right, thank you very much. We can see you. Thank you for indicating. So next, Makerere University Medical Students Association. Can you please indicate if you're present? Makerere University Medical Students Association, please use the raise hand feature. All right, thank you very much. Okay, so next, Medical Students Association of Malawi. Can you please indicate if you're present? Okay, I think we have a new MSA joining. Okay, Medical Students Association of Malawi. Yes, I can see you there. Next, Tanzania Medical Students Association UDOM chapter. Can you please raise your hand? Use the raise hand feature to indicate your presence. Again, Tanzania Medical Students Association. Can you please use the raise hand feature? I can't see any indication from Tanzania Medical Students Association. Next, we have Nnamdi Azikiwe University Medical Students Association. Can you please use the raise hand feature? Nnamdi Azikiwe University Medical Students Association. Okay, that's the second MSA that seems to be absent today. Ambrose Ali University Akuma. Okay, I can see NAU MSA. All right, thank you very much. Please make sure all your participants are visible. You might want to move your device a little further, as long as we can hear you clearly, but we need your participants to be very visible, please. We can only see half of certain people's faces and we can't see their upper bodies. So we'd really like to be able to see that, to avoid any allegations of misconduct. Okay, we still don't have any indication from Tanzania Medical Students Association. Okay, so next, Ambrose Ali University Akuma, Edo State. Are you here? All right, thank you, Ambrose. I can see you. Ahmadu Bello University Medical Students Association. Ahmadu Bello University Medical Students Association. I can't see any indication from. Oh, okay. ABU MSc, I can see you now. Thank you very much. So next we have FAMSA Tanzania. At FAMSA Tanzania, are you here? Ambrose Ali, you can lower your hand. Thank you very much. FAMSA Tanzania, are you here? Zimbabwe Medical Students Association, Great Zimbabwe University, are you here? Zimbabwe Medical Students Association, Great Zimbabwe University, are you here, please? All right, no indication from that MSA. Soroti University Medical Students Association, can I see you, please? Okay, thank you. I can see two devices from that association. So the only two associations, Tanzania and the Tanzania Medical Students Association, UDOM chapter. So we still have no indications from those MSAs. And if we start the competition now, Ambrose Ali and Soroti, you can lower your hands. Thank you very much. If we have no indications from those MSAs when the quiz starts, they will unfortunately be unable to participate. So I want to ask our quiz master again if he is ready for us and if you'd like to adjust the screen sharing. Sir, are you ready for us, sir?
Yes, can you hear me once
Yes,
again?
I can hear you. Yes, I can hear you very clearly, sir. Would you like to continue the screen sharing from your end?
Yes, I can screen share from my end now.
All right, thank you very much. I'm stopping my share now. While we are resetting the screen share, I want to inform everyone that the quiz is now being streamed on YouTube. So to the members of your audience, the members of your MSA who would like to cheer you on, please tell them to head over to I'll send the YouTube link here now. Please tell them to head over and encourage you all and support their MSAs via YouTube. Thank you very much.
Okay, thank you, Miracle. I think before we move on, I'll just try to check out some unnamed accounts. So who is Kabura Elisha? Please identify yourself, or else we'll dismiss you from the meeting now. Okay. Chukwuebuka, please renew accordingly to your role. Okay, who is Philemon Kiyombo? Please identify yourself, or else we'll remove you from the meeting. Please, if your MSA is not competing today, please just leave the Zoom meeting and join with YouTube. That's the right thing to do. Okay, so Mr. Philemon is not identifying himself, so we'll go ahead to remove now.
Okay, so is everyone able to see the screen?
Okay, we can go ahead. Thank you very much.
Okay, thank you. Yeah, so welcome. I hope the instructions are very clear. We are going to begin in the first round, we are going to begin from UCU and then come down to Soroti University. Medical Students Association. Then the second round, we shall begin from down coming back to UCU. So I'm going to start with UCU. Could you please pick your question and make sure your camera is on, we can see you.
Question 21.
Question 21. In what year was Muammar Gaddafi killed? 20 seconds.
In what year was Muammar Gaddafi killed?
2011.
Ndo swali.
What's your answer?
2011.
2011. Is that your final answer?
Yes.
Okay. Let's see if that's the answer. So the correct answer is 2011. So 5 points for UCU. Congratulations. Next is Mumsa. Could you please pick your question?
Is this answer?
Timekeeper, please. Timekeeper, please. Yes.
He answered before the time.
The answer before the time. Okay, please. You warn us if you're going to warn them. If they're using 20 minutes, you warn them after 10 seconds. After 10 seconds, you give them a warning. If the time is up, you give us a warn. I don't know how you're going to do that.
Yes, the bell is going to ring.
Okay, the bell is going to ring. Next is Mumsa.
Number 9.
Question 9. What was the first African country to join to gain independence?
Tukubaliane. If you
Number 25.
25 na mwisho. Ndikuta ni yes.
Could you mute, please? If you're not answering, please mute. Which country?
Yes.
Mumsa, what is your answer?
Egypt.
Egypt. Okay. Is that your final answer?
Yes.
And the correct answer is Ethiopia. So no point for Mumsa. We'll try again. There's some message which is I think should be FAMSA or something. I can hear Swahili. Please mute. When you unmute, answer, and then mute. The video should always be on. But the audio, you only unmute when you're answering. Okay, next is Tanzania, University of Dodoma, I guess. Tanzania Medical Students Association, UDOM chapter. Which question? Question? University of Dodoma? Are they around or not? University of Dodoma is not around. Okay, absent, recorded as absent. Then Medical Students Association of Malawi?
24.
Malawi 24. When did Queen Elizabeth II die? 20 seconds.
Ten seconds left.
2018.
2018. Which you remember the exact date? Okay, 2018. So the correct answer is September 8th, 2022. So when they ask when did, you are supposed to give us the month, the day, and then the year, unless otherwise stated. So no point for Malawi. Next is Namudi Azikwe. Which question? Namudi Azikwe, is it present or absent?
25.
Namudi? Okay, recorded as absent. Namdi has been recorded as absent. Are you there? 20 question what?
25. That was the same.
Okay, 25. Who is the first female director general of the World Trade Organization?
Ngozi Okonjo-Iweala. Dr. Ngozi Okonjo-Iweala.
Ngozi? What's your final
Dr.
answer? Is that your,
Okonjo-Iweala.
is that your
Yes.
final answer? Okay.
Yes.
The question is Ngozi Okonjo-Iweala. I think that's what I had. So 5 points for Namudi Azikwe. Congratulations. Next is Ambrose Ali University. I hope I pronounced that right. Ambrose Ali University. Please select your question.
Question 23.
Question 23. Yeah, Namudi, you're not very clear. Please be clear. I can hear. 23. When elasticity is 0, the demand curve is A, perfectly elastic, B, perfectly inelastic, C, concave, D, downward sloping. 10 seconds.
Elasticity was complex.
Time.
D.
Time
for
up.
D for dog. Okay. Time up. I don't. Did they answer in time?
Yes.
You
Yes.
said D for dog. I had D for dog.
Say
So no point for
B. You said B.
I had D for dog.
No, B for bed. B for bed. B.
Okay, so 5 points for Ambrose Ali. Congratulations. But next time, be clear. If you think you are delaying or network is disturbing, please type. Type in the chat. 5 points. Ahmed Bello, Medical Students Association. Choose your question.
Question 11.
Question 11. Who is the current leader of the Commonwealth countries? 20 seconds.
Commonwealth countries. That's Great Britain, huh? Yeah. The Prime Minister. That was what I'm thinking.
10 seconds left.
I have no idea.
Any idea?
You pass, eh?
Time up.
Okay, time up. 0 points. They were not able to answer. 0 points for Ahmed Bello. So the current leader, of course, the leader is always the King or Queen of England. King Charles III should be your answer. Next is Tamsa, Tanzania. Tamsa, Tanzania, present or absent? Recorded as absent. Great Zimbabwe. Zimbabwe MSA. Great Zimbabwe University. Are they present? Okay, recorded as absent. Then Soroti University Medical Students Association. Choose your question.
Question 1.
Question 1. What are the colors of the Pan-African flag? 20 seconds.
Red, green, and black.
Is that your final answer?
Yes.
Okay, let's see if that's correct. Red, green, and yellow. So unfortunately you missed out on yellow. You said black. It was a good try. However, you get a point for a correctly answered if you have answered fully. So no point for Soroti, but a good trial. Okay, that brings us to the end of the first round. We are going to go to the second round. We are going to begin from Soroti. Soroti, can you pick your question again? Or we first go back upwards? Soroti, are you ready to pick your second question? Or I go to UCU?
You go back up.
Okay, as you reorganize yourself. Okay, UCU? Choose your question. UCU? Is UCU present? Uganda Christian University, please choose your question.
Question 2.
Question 2, please be quick, be quick. How many electoral colleges are needed to win the American election? UCU?
$11.
11, is that your final answer?
Yes.
Okay, maybe next time you follow the elections closely. Trump needed 270 electoral colleges to win the election. And he won by what? Find out how much he won. He won just by slightly above 270. So the correct answer is 270. So no point for UCU. Good trial though. Next is Mumsa.
I would like to first ask, how do you know which questions have already been chosen because it's not indicated?
Oh, it is
And
not indicating. Yeah. Wow. Moderator, please, were you able to note? I wasn't able to note the questions you have been chosen, but
Unfortunately, that was meant to be set ahead, but it was not. If you pick a question and by the time we go to it, you find out that it has
okay,
already
it's okay.
been chosen,
We can just go back. It is okay.
Yeah,
We
I'll
shall
just
take
take note
that
of it
next time.
from here onward. Apologies
Yes,
about that.
henceforth we shall take note. So Mumsa, please choose. If someone has chosen it, we shall choose another one. But anywhere between 9 up to 17, and there are still virgin questions there.
Question 12.
Question 12. Okay. Which African president died in exile?
Which president was
10 seconds left.
Okay, 10 seconds left.
Kabaka
Mwanga, okay. Okay, next. Is that your final answer? The correct answer is your president. Unfortunately, you don't remember your president who died in exile. That was Idi Amin Dada, VC, SFC, the conqueror of the British Empire, and all those titles that you can give him. Field Marshal. So no point for Mumsa. Mumsa, hard luck next time. Next, we are going to Medical Students Association of Malawi. Medical Students Association of Malawi, choose your question.
Yes. 7.
Question 7. Yeah, question 7 has not been chosen. What is the capital of Rwanda?
Kigali.
Kigali. That was be so quick. And that's the correct answer, I guess. Let me see. Yes, Kigali, Rwanda. 5 points for Malawi. Medical Students Association of Malawi. FAMSA, University of Dodoma, I guess. Medical Students Association. UDOM? Oh, UDOM was absent. Namdi Azikwe, choose your question and be louder this time.
Question 10.
Question?
Question 10.
You work on your microphone. Actually, I can't hear. Even last time I didn't hear you. Question?
10.
Question 10. Okay.
10.
Okay. Which two African countries were not colonized? 10. You have 20 seconds.
10 seconds left.
Ethiopia and
Which ones?
Time up.
Time up.
Ethiopia.
Time up, Namdi Azikwe. Maybe you should revise your history. They were Ethiopia and Liberia. Okay, Freetown. So no point for Namdi Azikwe. Hard luck next time. Still have more questions. Next is Ambrose Ali University. Ambrose Ali University. Choose your question, please.
Number 14.
Number 14. You see, the rest of the guys are clear, but what? Namdi Azikwe, work on your microphone. In which year was the most recent Nobel Prize for Physiology awarded?
Wow. Move number.
10 seconds left.
Sorry?
2023. 2023. 2024.
2024. What's your final answer? 24. Okay.
2024.
The correct answer is you are not close to that. The correct answer is 2021. I don't recall in what. Maybe you find out which one was given. Which one was the last one? So 2021 is the correct answer. So you get no point.
Please,
Ahmad Bello.
Can we count the name of the person? Can we? Are we allowed to contest? Are we allowed to contest?
Yes, you're allowed to contest at the end. Yeah, maybe we are going to give you time to contest.
This question. Thank you very much.
Yes, you're going to contest. It's fine.
Question 20.
Next is the
Question 20.
Ahmed Bello. Ahmed Bello.
20.
Question 20. In how many countries is the Great Rift Valley found?
11.
How many?
7.
Is that your final answer?
Yes. Final answer.
Okay, the correct answer is 7 countries, so 5 points for for Ahmed Bello. Congratulations. And then finally, is Tanzania FAMSA around? Great Zimbabwe? They did not show up. Okay, Soroti University, choose your question.
Question 17.
Question 17. Question 17 was chosen, selected. Okay, a process by which a substance absorbs moisture from the atmosphere until it dissolves in it, until it dissolves in the absorbed moisture to form a solution is called
Hygroscopy. Hygroscopy.
Hygroscopy. Is that your final answer?
Deliquescent.
Okay. Are they still in time, moderator? Timekeeper, did they give the final answer in time?
No.
Okay.
Yeah.
Yes? Okay, they are still in time. So the correct answer is deliquescence, not hygroscopy. Well, you say deliquescent.
Yes, we said it.
Okay. I'll give you 5 points. I'll give 5 points for that. However, revise your chemistry, hygroscopy, the liquescency, and the fluorescency. Go back and know the examples of substances under each category. I would go ahead and ask you, give me an example, you'll not be able. Anyway, that brings us to the final round. Moderator, do we have another round or this is our final round?
No, we don't, sir. We're moving on.
So we only have 2 rounds. Okay, we are going to allow complaints from maybe those ones contesting, and then we see the people of the Nobel Prize, maybe the recent one is 2024. Let's check, let's find out. Back to you, moderator.
All right, thank you very much, sir. My apologies for that, for the question on the Nobel Prize. The answer is 2024. Yes. I have confirmed on this end.
Yeah, the correct answer is 2024. And can you remind us about in what? Just for the sake of knowledge. Wait, hold on. Which university was that?
Mozambique University.
Okay, can you tell us the Nobel Prize? It was awarded in what?
So it's always awarded every October, and it was awarded, I think, for microRNA into October 2024.
Okay, yeah, just for the sake of knowledge, I've given you a point already. But if you can tell us in what was the research for?
MicroRNA, conducted a research for microRNA.
Okay.
Those guys say 2023 when they are replying.
No, they said 2023, then 2024. But they had those two years. And 2024 was their last answer. So we give them the point for 2024. Who else was contesting?
I wanted to ask about question 9 and 10.
Yes, question 9 and 10.
About the first country to gain its independence in Africa. And the answer was Ethiopia. So then question 10 again talks about countries which weren't colonized. So did they...
Oh, yes. Question, you're saying question 9, eh?
It was 9.
9, our answer was Egypt.
Our answer was Egypt.
Okay, your answer was Egypt.
Yeah.
What was the first African country to gain independence? Yeah, and the answer was Ethiopia, which was wrong. Ethiopia was not colonized together with Liberia.
Exactly. So was Egypt, though.
Moderator, can you check that and then give us the correct answer, the final answer?
Yes, I have. The answer is in fact Egypt. So they get a point for that.
So Mumsa, let's correct. We are going to correct that. I'm going to correct that. So the correct answer is Egypt. Okay, congratulations, Mumsa. You have 5 points. Mumsa, which other question were you asking?
That's the only thing. Thank you.
That's the only thing. You have no problem with the other previous question, eh? You accept that you didn't know it. Okay. Any other complaints? Soroti,
Yes.
please.
Yes, we wanted to clarify on our question 1, where we were asked the colors of the Pan-African flag, and our answer was black, red, and green.
Yes, you said red, green, and black. I remember I recorded that. Moderator, what are the correct colors?
Yes, sir. The colors are red, black, and green, sir. I've confirmed.
Yes, I can see the flag here. The colors are red, black, and green, not yellow. What was the answer?
The answer they gave was red, black, and green. Actually, there was an
their answer was correct. Red,
yes,
red,
their
black,
answer was
and
correct,
green.
sir.
The answer was correct. We apologize. I think The organizers are going to apologize, I think, for those mistakes, but those mistakes happen. So Soroti, your answer is correct. Soroti, you have 5 points for that. Congratulations. Any other complaint? I guess we're even now. Okay, back to you, moderator. We go to the next section. Or if you have any message to pass on before we proceed.
No, I don't, not at the moment. But good luck to everyone. I believe the quiz master will reshare the screen with the questions for the preclinical round now. So thank you everyone for your participation so far. Let's move on to the next section.
Okay, we are going to preclinical questions. Let me, as I prepare to share the screen, warm up.
Thank you very much, Quizmaster. I think I should just state that some MSAs are closing their video. The video has to be on at all time, please.
Yes, the video should be on.
If any MSA that closes the video again will be disqualified. The video should be on at all times, and we should be able to see the faces of all the participants. And yes, and the video should also be at least at your forearm level, so you can also see your arm.
I hope that is very clear. There's someone monitoring. If you see anyone trying to be assisted, please let us know, and then we disqualify them immediately. Medical students of Malawi raise their hand.
I just wanted to say there's been issues with our connection, so we've been and rejoined a few times of the meeting.
Okay, they are going to allow you
to put that out there. Thank you.
Where are the slides?
Okay, so the score recorder, while the preclinical questions are being shared, the score recorder will be putting up the current standings in the chat box. If you'd like to send that out to your MSAs, that would be great. So yes, that's currently in the chat box. You can see the standing of the scores. If you have any complaints as to what was recorded for your MSA, it's a great time to bring it up now, because when we move to the next section, this section will be assumed to be completed. Thank you very much, everyone.
Can anyone see it?
Yes, we can see. So at the end of this round, UCU has 5 points. I guess that is correct. MUMSA has 5 points. Malawi Medical Students Association of Malawi has 5. Namdi Azikwe 5. Ambrosi Ali University 10. Ahmed have 5. Then Sorot University have 10. The rest have 0. Those that didn't show up. Okay, we're getting ready. So it's taking long to download, but now here we're starting.
Okay, should I stop sharing my screen?
Yes, please. You can stop sharing and then I share.
Okay.
So again, we're going to have 2 rounds in the preclinicals. The next category is preclinicals. We are going to have 2 rounds. And remember, most of these are multiple choice, and so you only have 10 seconds. Are you able to see my screen? Can you see my screen?
Yes.
Yes, we can.
Okay. Okay, so still the instructions remain the same. We are going to go straight to UCU. Choose your question, please, UCU.
Question 7.
Question 7. 7 is your lucky number. What is the normal membrane resting potential for a regular cell? A, negative 50 millivolts. B, negative 90 millivolts. C, negative 60 millivolts. D, negative 100 millivolts. And E, negative 70 millivolts. 10 seconds.
E for egg.
E for egg. That's good answering. E for egg. So the correct answer is negative 70 millivolts. Congratulations. You see you 5 points. Mumsa, what's your question?
9.
Question 9. What reaction is catalyzed by 5' stop 3' mono deiodinase? A, conversion of T3 into T4. B, conversion of TSH into T3. C, conversion of TSH into T4. D, conversion of T4 into T3. And E, conversion of T4 into TSH. 10 seconds.
T4 to T3 because T3 is the active.
D.
D.
D for?
Dog.
D for dog. Is that your final answer? Yes. So it converts T4 to T3 if you go back to your thyroid hormone synthesis. Remember, majority of the hormones are in form of T4, but the tissues utilize T3. So T4 must be converted to T3. That's the correct answer. 5 points for Mumsa. Congratulations. Next is Malawi. We only have one Malawi. So So Malawi, I'll call you by your country.
11.
Question 11. Which of the following molecules control the ecase enzyme via feedback mechanism? A, UTPs, B, CAMP, C, CTP, D, GTP, and E, ATP. 10 seconds.
B for ball.
B for boy, so cyclic MP, CAMP, okay? And that's not the correct answer. The correct answer is CTP. Okay, we try again. Day biochemistry there. So 0.4 Mumsa for Malawi. Next is Namdi Azikwe. Your microphone should be loud. Namdi, choose your question. Namdi. Is it me who is not hearing? Okay, if Namdi is not there, we are going to go to the next. Ambrose Ali University, choose your question, please.
Question 21.
Question 21. Is Namdi there? They are not speaking. I hope everyone is not hearing them. Okay, question 21 for that is Ambrose Ali. Is that Ambrose Ali for question 21?
Yeah. 21.
Okay. Namdi is not around. Question 21. Which underlying pathology may cause an increased risk of bilirubemia in infants of diabetic mothers? A, vitamin A deficiency. B, iron deficiency anemia. C, leukemia. D, hyperthyroidism. And C, polycythemia.
Can I? Oh, can I or you be or you? Go E. Or
E,
D.
D for egg.
D. D for dog.
D.
D for dog.
Okay, D for dog. I've locked it at that. And D is not the correct answer. The correct answer is polycythemia. Polycythemia. You're thinking loud. First participant of Ambrose Ali, please. Let the camera be showing all of you. There's one participant behind there. I cannot appreciate them. Yeah. Okay, I want to appreciate. We want to appreciate all of you. Okay.
Also now.
Yeah, fairly good. Though he's at the back. You guys are flanking him, so you may not be able to see him properly. It's fine. It's fine.
Okay, thank you.
Next is Ahmed Bello Mumsa. Ahmed Bello, Medical Students Association.
Question 7.
Question 7 has been taken.
Okay. Question 14.
Question 14.
Let's not think out too loud.
Which of the following are ketogenic amino acids? A, isoleucine and valine. B, lysine and leucine. C, tyrosine and glutamate. D, glycine and asparagine. And then E, threonine and serine. 10 seconds.
B, lysine and leucine.
Lysine and leucine. B. That's the correct answer. Congratulations, 5 points. And then finally, Soroti University Medical Students Association. Choose your question.
Question 1.
Question 1 was taken, is it? Let me see. Okay, question 1. Which statement is true regarding uterine anatomy? A, The fallopian tubes lie below the level of the ovaries. B, version is the position of the cervix with respect to the ureters. C, the endometrial thickness is in a postmenopausal woman is 4 centimeters or more. D, the normal endometrial thickness is in a premenopausal woman can be up to 40 to 50 millimeters. And then E, the position of the uterine body can be anteflexed or retroflexed with respect to the cervix. What's your answer?
Option E.
Option E. Okay. And the correct answer is that. So the body of the uterus can be anteflexed or retroflexed with respect to the cervix, meaning can be facing over the bladder or facing backwards, retroflexed. Okay. 5 points. And that brings us to... Sorry?
It says 5 points for what, MSA?
5 points for sorority. Nnamdi Azikiwe went off. Nnamdi Azikiwe went off. So they have not been able to participate in this. I don't know what's wrong with... I don't see any message from them.
Yeah, we were logged out of the call.
Sorry?
Yeah, we were logged out of the call.
No, you logged out yourselves, I guess. Okay. You're back now?
No, like it was network issues. We didn't log out ourselves.
All right, it's fine.
We were about to complain before we were like logged out of the call.
All right, okay. Choose your question, please. What's your question?
Question 13.
Question 13, please find good network. Which of the following amino acids is commonly found linked to an oligosaccharide in N-linked glycoproteins? A, glutamine, B, threonine, C, asparagine, D, serine, and E, valine.
A for apple.
A for apple, glutamine.
A for apple. A.
Okay, A is the wrong answer. The correct answer is asparagine. And you get no point. Okay, next round, UCU, choose your question.
Question 15.
Question 15. Which of the following is true regarding smokers? A, 2,3 BPG levels fall. B, high 2,3 BPG levels favor the R state, so oxygen is retained. C, 2,3 BPG binds myoglobin. D, low levels of 2,3 BPG favor the T state, so oxygen is released. And E, they are more likely to have increased 2,3 BPG levels. 10 seconds.
E for egg.
E for egg. They are more likely to have increased 2,3 BPG levels. Let's see. Okay, and that's the correct answer. Congratulations, 5 points for UCU. 5 points. Very tight. Mumsa, choose your question.
Question 8.
Question?
8.
Oh, sorry. Sorry about that. Question 8.
Yes.
Question 8. Which of the following pneumocytes are immature in premature infants, causing trouble with alveolar ventilation? A, type 4, B, type 5, C, type 1, D type 2, and E type 3.
Okay.
What's the answer?
A.
Are you sure?
Time up. Time up already.
Yeah.
Time up. Momsa, remember, type 2 pneumocytes. Type 2 pneumocytes produce surfactant. Okay? Produce surfactant, so no point for Momsa. No point for Momsa. Next is Nnamdi Azikiwe. Oh, no, sorry, Malawi. Malawi.
25.
Question 25. Malawi, question 25. Yeah, question 25. Which substance would activate a muscarinic cholinergic receptor but not a nicotinic cholinergic receptor? A. Labetalol. B. Carbaco. C. Methacholine. D. Acetylcholine. And E. Pilocarpine. 10 seconds.
What's Carbaco? B for ball.
B for boy. Carbaco. Okay, Carbaco. Is that your final answer? Yes. The correct answer is pilocarpine. Pilocarpine, which is A. Correct answer is pilocarpine. So no point for Malawi. We try again. Nnamdi Azikiwe. I hope your network is okay now.
Yes, thank you.
Please, Master. Sorry, my network went off. So
Question?
I said my network went off, so I didn't record the score for the round 2. I don't know which MSA are we on now.
Yeah, we have finished UCU. Momsa Malawi was the one we were on, got no points. Now we are on Nnamdi Azikiwe. So don't mind. I'm also.
UCU, did they get the round?
Okay, yeah. In the second round, UCU had 5 points. Momsa had no point. Malawi has no point. Now we are on Nnamdi Azikiwe. Is that okay?
Okay.
Okay, Nnamdi Azikiwe, choose your question. Question 18.
18.
18? 1-8.
Yes.
Yes.
Okay. Aphlexia is a common finding for pathology at which location? A. Cerebellum. B. Muscle. C. Neuromuscular junction. D. Peripheral nerve. And E. Amygdala. 10 seconds.
A for apple.
A for apple. At the cerebellum, you have a reflexia. Well, the correct answer according to this is peripheral nerve, which is D. Peripheral nerve, which is D. So no point for Nnamdi Azikiwe. We still have this. We can keep trying. Next is Ambrose Ali University.
Which one? Number 3. Question number 3.
Question number 3. Where do the pulmonary veins drain? A, the right atrium. B, the left ventricle. C, the left atrium. D, the bronchial veins. And then E, the right ventricle.
Left atrium. C, left
C
atrium.
for start. The left atrium. I see Soroti University is laughing. Eh? Okay. The correct answer is the left. The correct answer is the left atrium. Congratulations. 5 points for Ahmed Bello. Then Soroti.
No, we're next to pick question.
Sorry?
We are next. That's Ambrose Ali.
Oh, that was Ambrose Ali. Next is Ahmed Bello. So 5 points for Ambrose Ali. Next is Ahmed Bello. Please choose your question.
Question 5.
Question five. Yeah, it was not yet taken. What's the partial pressure of oxygen, PaO2, in deoxygenated blood? A, 100 millimeters of mercury, B, 50, C, 45, D, 40, and E, 140, all in millimeters of mercury. 10 seconds.
Option D, 40.
Option D, 40 millimeters of mercury. And option D is the correct answer. 5 points for Ahmed Bello. Congratulations. Soroti, choose your question. Soroti University.
Question 23.
Question 23. Which medication class is used to treat inflammation associated with asthma? A, long-acting inhaled bronchodilators. B, methylxanthines. C, short-acting inhaled bronchodilators. And then D, corticosteroids. 10 seconds.
D, corticosteroids.
D, corticosteroids. D, corticosteroids is the correct answer. Congratulations. And that brings us to the end of the preclinical round. We warm up, you can stretch for the clinical round. Meanwhile, the score recorder can give us the... Unless, is there anyone having a concern and a complaint? We address that before they give you the scores.
Yes, please. Our first question.
What was your first question?
13.
Question?
Should be question 13.
Question 13. Which of the following amino acids commonly found linked to oligosaccharides in N-linked glycoproteins? Why do you think your answer was correct?
I want to confirm.
Yeah?
I want to confirm our answer. We chose glutamine.
Moderator. So why do you think your answer is correct? Glutamine, why do you think it is glutamine? The correct answer is asparagine, and we shall go with that, yeah? We shall go with that as the final answer. The correct answer is asparagine. We shall go with that. Maybe you can find out which other amino acids, if glutamine is one of them. But the correct answer, according to Lecturio, our sponsors gave asparagine, and they have that explanation. If you check it out later, that you find out that asparagine is the correct answer. The exact biochemistry, I'm not so certain about that. But let's go with Abumsa has a point, has a concern.
Yes, we wanted to request that since we're done with this round, whether we can take a break.
2 minutes.
Sorry?
Can we pee?
We want to take a break, a short break.
Oh, you want to take a pee? Okay.
Yes.
Yeah, we shall. I don't know, moderator. You are supposed to have peed before you come to the exam. So, moderator, I don't know if you can allow them to do that. So, no other concerns. No other concerns. Back to. Okay, we are going to take a 5-minute break. We shall take a 5-minute break. And asparagine has been confirmed from Lecturio as the correct answer. Yeah. So we shall take asparagine to be the final answer. Any other concern? Any other concern, please? Any other concerns? No concerns. Okay, I think that's fair enough. Okay, that's fair enough. You can take a 5-minute break as we set for the next round. Remember, we still have more 3 rounds to come. Pode? Arriba, Okay, are we back? I'm going to do a quick roll call. We should be quick. We should be out of here in the next 30 minutes or so. UCU, is UCU back?
Yes,
is UCU back? Okay, Mumsa, is Mumsa back? Is Mumsa back on call?
Yes.
Malawi?
Yes, we're here.
Namdi Azikwe? Namdi Azikwe back?
We are here. We are here.
Okay, Ambrosi Ali?
Yes, we are here.
Present.
Ahmed Bello?
We're here.
Yes, we are here.
And then finally, Soroti. So TAMSA did not show up. Zimbabwe Medical Students Association. Okay, I hope they're watching us on YouTube. Okay, next is we are going to the clinical questions. Okay, okay. Okay, network. Okay, let's confirm. Let's confirm your scores for the preclinical round. Score recorder, please tell us the scores for the preclinical round. Score recorder.
So I want to run the list of MSA and confirm them. I'll run through the list of MSA confirm the
Okay.
scores. So UCU MSA, there are around 2 questions round. Did they get that
Yes.
correctly? UCU MSA, can you please confirm that?
UMSA,
Yes.
UCU.
Yeah, we passed around 2 questions.
Okay.
All right, thank you very much. I'm so very glad to receive MSA. Monster did not get the question.
Mumsa had 1 question correct.
Yes, they had the first round question correct. For round 2, they did not get the question correct.
Yes.
All right, thank you, sir. Medical Students Association of Malawi did not get the question correctly.
That's true.
Thank you, sir. Tanzania did not show up.
That's true.
Thank you, sir. Nnamdi Azikiwe had they did not get the second round question.
They did not get the first one and the second one.
Yes, sir. Thank you. Ambrose Ali University. Can you please confirm if Ambrose Ali University got their round 2 question?
Yes, Ambrose
Ambrose Ali,
Ali
can you please
passed.
confirm?
Ambrose Ali passed the second one, but did not pass the first question. So there are 5 points.
Yes, sir. So ABUMSA, they get the round 2 questions.
Yes, they got all the questions correct.
Oh, all right, thank you very much, sir. Zimbabwe MSA.
Did not show up.
Oh, yes, that's correct. Soroti MSA, I think they got their last question wrong.
Yes, they got all their 2 questions correct. Yeah.
Oh, both questions correct. All right, thank you very much, sir.
Okay, thank you very much, score recorder. And thank you very much, the MSS. Welcome back. We are going to the clinical round. Let me share my screen. Okay, are you able to see my screen?
Yes, sir.
Yes, we can see it.
All right. So this is the clinical round. This is the clinical round. We say the same instructions hold. Make sure your faces, hands are seen properly. Like I like Medical Students Association of Malawi. They're all visible very well. Thank you very much. Yeah, and your lighting is good enough. And Soroti is trying, but Soroti, I'm not seeing your third participant. Soroti, your third participant is hidden, even Abumsa, and then the others. Anyhow, our person, the monitoring on the cameras will be seeing you. Okay, you see you. Please choose your question.
Question 7.
Question?
7.
You see you 7. What's wrong with 7? Okay, question 7 for you see you. What solution is most commonly used for wound irrigation? A, tap water. B, 0.9% sodium chloride. C, 0.45% sodium chloride. And D, sterile water.
B
0.9%.
Sorry?
B for boy.
B for boy. B for boy. Okay, normal saline, 0.9% sodium chloride, and that's the correct answer. Congratulations, UCU 5 points. Makerere University Medical Students Association.
Question 5.
Question 5. How long does an ERCP take to perform? A, 6 hours. B, 4 hours. C, 30 to 90 minutes. And D, 15 minutes.
It's not counting the pass. We have 10 seconds.
Almost done. It is something.
30
to 90 minutes.
C.
30 to 90 minutes. C. Let's see if that's correct. Yeah, and that's correct. What's the ERCP, by the way? Mumsa, what is the ERCP? Next is a Medical Students Association of Malawi.
18.
Medical students. Okay, Malawi, which question?
18.
Question 18. Which of the following agents unmask manic episodes in patients with bipolar disorder? A, antipsychotics. B, dopamine antagonists. C, bronchodilators. And D, steroids. E, antidepressants. 10 seconds.
If antidepressants.
Antidepressants. Antidepressants, the correct answer. 5 points for Malawi. Congratulations. Namdi Azikwe, choose your question. Namdi?
15.
Question 15.
15.
Okay.
15.
Okay, I've gotten that. 15. Where in the body is antidiuretic hormone created? A, posterior pituitary gland. B, pancreas. C, thymus. And D, adrenal gland. You're laughing. Okay?
A for
apple. Yeah, Malawi is laughing at you. Eh? They're saying what an easy question. A for apple. Okay, posterior pituitary gland. 5 points.
Oh, yeah.
Congratulations. Next is Ambrose Ali.
Question number 6.
Question number 6. Question number 6. Which age group is most likely to suffer from renal artery stenosis resulting from fibromuscular dysplasia? A, young males, B, geriatric males, C, young females, D,
young females.
pre-adolescent females, E, children, yes?
Young females, C.
Young females, C. That's your final answer?
Yes,
Young
please.
female C is the correct answer. 5 points for Ambrose Ali. Congratulations. Next is Ahmed Bello.
Question 18.
Question 18. 18, okay. 18 was taken. Question 18 was taken. Choose another question, please.
17.
Question 17. A 19-year-old male sports enthusiast reports to your psychiatric clinic with history with his family because of repeated outbursts of anger resulting in police involvement. On physical exam, he is very well muscled with moderate acne on his face and back. What is highest on your differential? A, glucocorticoid use, B, antisocial personality disorder, C, anabolic steroid use, D, psychotic episode, and E, delayed puberty.
Option C.
Option C, anabolic steroid use. Anabolic steroid use is the correct answer. 5 points. Congratulations. Would be abusing steroids. Soroti University.
Question 12.
Question 12. A 25-year-old gravida 1 para 1 with a history of asthma and no other medical problem just delivered her baby by cesarean section after arrest of the first stage of labor after prolonged rupture of membranes. In the operating room, there is a suspicion for chorioamnitis and difficulty achieving uterine tone after uterine massage, removal of products of placenta and membrane tissue, and closure of the hysterectomy, and she is receiving oxytocin infusion. Which of the following treatments should be given immediately to help limit the uterine atony? A, fresh frozen plasma. B, antibiotics only to treat the root cause. C, PGF2 alpha in bracket hemabet, and D, methyl igonovin or methagine, and E, cryoprecipitate. 10 seconds.
Option D, methagine.
Option D for dog. Okay, option D for dog is correct. Methagine should be given to control the tone. You see you? Uganda Christian University.
21.
You see, are you there? 21. 21. You like multiples of 7, eh? Question 21. What visual defect may occur in patients with pterygium? A, hyperopia. B, photophobia. C, mydriasis. D, diplopia, and E, myopia. 10 seconds. Yes? Time up. Time up.
She was answering.
What was her answer before time up? I had E, but she answered when the time was up. But anyway, E was incorrect. So the correct answer is D for dog, diplopia. Next is Mumsa.
Question 9.
Question 9. Which of the following is not a finding in an infant of a diabetic mother? A, hypoglycemia. B, infantile type 1 diabetes. C, duodenal atresia. D, polycythemia. And E, cardiomyopathy.
They have hypo.
Swimming which?
Text. You're sure cardiomyopathy is there?
Yeah, it is there.
See.
C for duodenal atresia. Okay, the answer before time. So the answer is infantile type 1 diabetes, and C is not the correct answer. No point for Mumsa. Hard luck. Namdi Azikwe. Question 22. What syndrome is associated with keratoconus? A, Marfan syndrome. B, Treacher-Collins syndrome. E, Ehlers-Danlos syndrome. D, Pierre-Robin syndrome. And E, Herfordshire-Wardstrom syndrome. I hope that's correct. 10 seconds.
D.
D for dog?
Yes.
Okay, Pierre-Robin syndrome. The correct answer is Ehlers-Danlos syndrome. No point for Namda Zikwe. Next, Ambrose Ali University.
Did you mention?
I'm sorry.
Oh, Malawi has skipped you?
Yes, you skipped us.
Okay, Malawi, come next. Malawi, come. I skipped you. Sorry about that.
Question number 1, sir.
Question number 1. Okay, a 31-year-old woman just delivered her baby at 34 weeks gestation 5 days ago. Her baby boy is in the nursery for phototherapy to treat hyperbilirubinemia, but he is otherwise healthy. Although the mother was discharged from the hospital, she continues to visit daily to breastfeed her baby and pumps milk in between feedings for the baby to have overnight when she is away. She cries several times a day, and especially at nighttime when she feels guilty that she cannot be with her baby. She tells her husband that she is overwhelmed by the whole situation of delivering the baby earlier than anticipated and wishing she could have been more prepared. What is the most likely diagnosis for this patient? A, postpartum psychosis. B, postpartum blues. C, postpartum anxiety. D, normal health. And E, postpartum depression. 10 seconds.
B for ball, postpartum blues.
Postpartum blues. Is that your final answer?
Sure.
Yes, the mother has postpartum blues. Congratulations, 5 points. Or maybe later you'll tell me how it differs from postpartum psychosis and the others. Okay, but let's continue.
We can tell you.
Oh, it's okay. It's okay.
We have data.
Thank you. Okay. Ambrose Ali University. Ambrose Ali University, choose your question.
Question number 4.
Question number 4. Gallbladder effect suggests constriction of renal artery causes secretion of which of the following substances? A, erythropoietin. B, angiotensin. C, renin. D, adrenaline. E, ADH.
Go with C, renin.
Renin.
Yes.
Renin. Okay, renin is the correct answer. Renin is the correct answer. Maybe later you remind me with the renin angiotensin aldosterone system. Okay. Next is Ahmed Bello Mumsa. Medical Students Association, Ahmed Bello, MSA.
Question 2.
Question 2. Which of the following findings is not seen in ectopic Cushing's syndrome? A, hyperkalemia, B, acne, C, muscle weakness, D, purple striae, and E, edema.
Muscle weakness. I'm thinking hyperkalemia. I'm thinking hyperkalemia too. Well, you guys should go sharply.
Option A.
Option A for
Apple.
apple. Okay. A for apple, hyperkalemia. Hyperkalemia is the correct answer. Congratulations. 5 points for Ahmed Bello. And finally, Soroti University. Soroti University are doing so good, okay? Let me hope you keep the fire burning. Choose your question.
Question 3.
Question 3. Which of the following is an indication for surgical intervention in patients with necrotizing enterocolitis? A, pneumoperitoneum detected by abdominal imaging. B, laboratory evaluation showing thrombocytosis and eosinophilia. C, preterm infants with a gestational age below 32 weeks. D, patients who cannot tolerate oral intakes. And E, dilated loops of bowel detected by abdominal imaging. 10 seconds.
A for apple.
A for apple. Air in the peritoneum. Okay, let's see. Okay, pneumoperitoneum detected by abdominal imaging. Congratulations. Congratulations, Soroti University. 5 points for Soroti University. And that brings us to the end of this round. Score recorder, back to you. Score recorder before we go to the final session.
Okay, sir, I am calculating it now. I would share my screen.
Okay. Okay, that's fine. Are those anyone with any concern? Anyone with any concern? Anyone who wants to explain to us something? Why we need to intervene if there is pneumoperitoneum in necrotizing enterocolitis? Soroti, would you want to explain to us, or you just chanced it? Eh?
Let's try to explain it maybe.
Okay.
So when there is evidence of pneumoperitoneum, it means that your bowel has perforated. So when bowel perforates, air goes to the peritoneum. So when you have evidence of that on abdominal imaging, then you can actually open and maybe resect, then anastomose.
Okay. Okay, that's a good explanation. So air is an indication of perforation, gut perforation. So you resect and anastomose. Okay, thank you. Who else wants to? Any other person wants to give us some wisdom?
I
Medical
think the
wisdom.
MSA with postpartum blues
Yes,
seems
postpartum blues.
very
Okay.
Oh, postpartum blues, please shine.
Yes,
to explain.
yes. So, there is postpartum depression and there's postpartum blues, right?
Yes.
And also psychosis. Those are
And
those are the perinatal psychotic or psychiatric diseases that are present. So the difference between postpartum blues and postpartum depression is the timeline itself, right? So the timeline is that postpartum blues usually occurs from days 2 up until 14 days or to 10 days, somewhere around there. However, for postpartum depression, it should occur 1 month after or 6 weeks later after delivery of the child.
Okay, so the duration, okay?
Yes.
Thank you very much, Malawi. Thank you very much, Malawi. Okay, score recorder, please.
Sorry, Asa, I did not get the score for Uganda Medical Association. So that's why.
Makerere University. Which one? Uganda Christian University?
Yes, sir.
Yeah, they passed the first one, but did not get a point for the second question.
So for I don't know, is everything okay here? Don't know if I made
Yeah,
any.
everything looks fine.
Okay, so I would.
Anyone complaining about the scores? Apart from UCU, of course, UCU did not get the second one. Otherwise, everything I think is what I've also recorded. Thank you very much.
Okay.
Thank you very much. No complaints, so we go to, let's go to our final round. Okay, we've got our final round of math and logic. I hope you are ready.
Sorry, Quiz Master. I just want to note that there's a participant named MSA. So whoever that is should rename properly. So we can know what MSA represents.
Let me see. Yeah, who is that? Please rename your MSA. Who is MSA? If you don't rename, then we are going to remove you from the call. Rename it according to your MSA. There we go. So similar instructions. So this is the last set of questions for math and logic in our preliminary stage for group 1. And we shall go straight to our questions. Beginning with UCU. Oh, UCU, you've overstarted. Can I begin with Soroti this time? Okay, Soroti University, let's begin with you. UCU has a question?
Really grateful, thank you. You saved me.
Would like to ask, are calculators are allowed in this round?
No calculators are allowed. No books allowed. No rough work. So everything should be in the head. So make sure your hands, by the way, this is very important in this category that we should be seeing we should be seeing all your torso. You should be seeing your trunk, apart from the pelvis, maybe and perineum, but you should be seeing the entire body and then the upper limbs very well. Okay. Any other concern, any other query? If no, then we can proceed. Soroti University, choose your question. We are beginning from down up.
Okay, question 13.
Question 13. Four times the sum of 9 and a number represent as an equation.
So, part 1, 2, 1, 3. And then, what's 200? Hey, Pepe. Pepe.
Sorry?
You bought Pepe again? Yeah. Oh, wow.
You see, rather, Soroti, you have, what's your answer?
Isn't that an equation? 4 times 9x. 4 times 9 plus
Time's
x.
up. Okay, time up. You see, I think maybe I failed to interpret the question. It is 4 times the sum of 9 and a number. So sum of 9 and a number is in the bracket, and then 4 is outside the bracket. So 4 into 9 plus n or x, whatever you want to call it. So you get no point. Rather, sorry, use not you see you. Soroti gets no point. You next is Ahmed Bello. Ahmed Bello, choose your question.
Question 7.
Question 7. You have taken usage number. Okay, which of the following is a perfect square? 1057, 625, 7928, 6400, or 64,000. You have 10 seconds.
625.
625. 625 is a perfect square. So 5 points for Ahmed Bello. Ambrose Ali University, choose your question.
Excuse me, please, sir.
Yes.
Sorry to interrupt you. I've been trying to get your attention. Papers and pens are allowed for solving the math questions. However, the camera must
Yes.
pan to you and must clearly show that you are writing with a non-electronic pen on a hard copy sheet of paper. So if you
Thank
cannot
you.
provide that kind of camera view, then you have to provide that kind of camera view. That's the essence. All right. Thank you very much, sir.
Thank you very much, Abraham, for that clarification. So you can use a pen and paper, but no calculator. Okay, it should be an ink pen, not an electronic pen. Okay, very good. But make sure we see the surface from which you're working from. If you can't do that, then please don't. Ahmed Bello, 5 points. Next is Ambrose Ali. Please choose your question.
Question number 6.
Question number 6. Express 1, 2, 3, 4, 5, 6. So 3 significant figures.
1, 2, 3, 0, 0, 0.
1, 2, 3, 0, 0, 0.
1, 2, 3, 0, 0, 0.
0.
Okay, 3 zeros. And that's correct. 123,000 is the correct answer. So 5 points for Ambrose Ali University. Namdi Azikwe, please choose your question. Namdi Azikwe. Namdi Azikwe, are you on? Namdi. Okay, they are nowhere. Oh, sorry, question 1 has been displayed already, so shall not use it. Namda Zikwe is not there. Next is Malawi. Malawi.
Question 11.
Question 11. What is the sum of the opposed interior angles?
$120.
120. Why 120? The sum is 180. The opposite interior angles add up to 180. In other words, they are what? So Malawi, no point for Malawi. Makerere University Medical Students Association. MUMSA.
Number 5.
Number 5. A company X sold 1,500 units of its products for $9 each and 750 units for $6 each. If the company's cost of producing each unit of the product was $7, what was the company's profit or loss on the sale of 2,250 units? You have 20 seconds. Good luck.
He has to actually give you.
60.
Time up.
Your time up?
Get a warning.
Oh, time up. Time up. The correct answer is 2,250. As a profit. Okay, hard luck, Mumsa. You, they took your 7. Okay, this time what are you taking?
18.
Sorry?
Question 18.
Question 18. Arrange the following words in a meaningful sequence. Infection, consultation, doctor, treatment, recovery. 20 seconds.
Infection, consultation, doctor, infection, treatment, recovery.
Consultation. Doctor. Infection.
Treatment
and recovery.
Treatment and recovery. Okay, so you want to consult a doctor before infection? Huh? You see, you want to first consult and then, okay, doctor, I want to get an infection. Then you go back and get infected. So the order is infection. If you get infected, you see the doctor. You consult them, they treat you, and then you recover. Okay, hard luck. You see you. Next is sorority again. Sorority.
Question 3.
Question 3. The mean and median of 7 distinct positive integers is 30. If the 7 integers are such that their product is maximum, what is the product of the smallest and the largest integers?
Yes,
30.
Your answer is 30. And the correct answer is 891. Correct answer is 891. So no point for Soroti University. Soroti University. Anyhow, you're doing good. Don't worry. Ahmed Bello, MSA.
Question 25.
Question 25. If 1 0 of the quadratic polynomial x squared plus 3x plus b is 2, then the value of b is... Oh, sorry, what was that? What's your answer?
0. I don't know it's not. It's 2, 3. Oh, good.
Which one?
Let's do 0. 0?
Okay. 0.
Your answer for B is 0? The correct answer is negative 10. Negative 10. If you solve that, you'll get... So no point for Namdi Azikwe.
Please, can we see the available questions?
Sorry?
Can we see the available? You can't see the questions. Like the...
Okay, Namdi Azikwe, choose your question. 13, 7, 1, 25 were taken. Sorry, I think when it came back. So you choose others apart from that.
20.
Question 20. What are the 4 branches of philosophy?
Wait, that's 60. Let's see.
Say something.
You don't know it. With arithmetic.
Okay. What else?
Logic.
Logic,
Time up already.
Okay, time up. Time up. It is metaphysics, epistemology, axiology, and logic. You got 1 correct, but unfortunately, it's okay. You know, it's fine. It's fine. It's fine. So, which university was that? Remind me. That was Namdi Azikwe. Next is Malawi.
Please, we were jumped to Ambosali have not been asked a question, and you were coming down. You jumped us to Nnamdi Azikiwe from what we observed.
Okay, Ambrose Ali, please. What's your question? Choose your question. Apart from 7, 13, 25, 4.
Question number 9.
Question 9. The average weight of 8 persons increased by 2.5 kilograms when a new person comes in place for one of them, weighing 65 kilograms. What might be the weight of the new person?
Minus 25, that's 30 kg.
65 is 60, 67.5.
67.5 kg.
51?
67.5 kg.
Okay, 67.5 kilograms.
No, wait. It's 85.
It's time up already.
You already gave your answer when the time is up.
85.
You gave your answer when the answer. Okay, hard luck. Next time, Ambrose Ali. No point for Ambrose Ali. University. Sorry about that. Next is Malawi.
So question number 3.
Question number 3. Question number 3. Okay. The mean number 3 was taken, was already chosen. So choose another question.
Okay, let's go number 17.
Okay. 17.
17.
Question 17. Okay, what is the odd number from the given alternatives? 1090, 962, 626, and 841. You have 10 seconds.
841.
841. Okay, 841 is the correct answer. Mumsa?
23.
23. What is the base of a triangle if area is 40 centimeters squared and height is 10?
Was equal to what? I have base times height. 40 centimeters. I have this one is height 80 divided by 10. Then 8. I have times 10 times 8. 8. 8
What's the answer?
centimeters. 8
Sorry?
centimeters. 8 centimeters.
8 centimeters. 8 centimeters is the correct answer, Mumsa. Congratulations, 5 points. And then finally, what is your answer? What's your question? Final question.
21.
21. When an information is complete, it is termed as dash. A, data. B, premise. C, fact. D, all the above.
We are going with C, fact.
C for cat, fact. C for cat. Okay, it is a fact. 5 points for for UCU. Congratulations, UCU. Any concerns, any complaints before they give you the final scores for all the rounds? Makerere University.
Round. We were only
Sorry?
asked one question this round, sir. We were only asked the question in this round. We were not asked 2 questions.
But I called when you're not around.
So we had
We've been
network
having
problems.
serious technical difficulties, sir.
Okay, I'm going to give you a benefit of that. But Namdi Aziku, when you go to the next round, please make sure you have a good network. Okay, choose your question.
Question 15.
Question 15. Okay, find the area of a trapezoid with the bases of 12 meters and 6 meters and the height of 5 meters.
Then I'm doing
Yes, ma'am. Yes, ma'am.
45. Yes. 45.
Your answer is 45?
Yes.
Okay, and 45 is the correct answer. 5 points for Namdi Azikwe. 5 points for Namdi Azikwe. Okay, that brings us to the end of this session, the preliminary round for Group 1. Are there any concerns? Mumsa was having a concern.
Would like to
Yes,
ask
Mumsa.
about question 5. It was too long and would like to know the logic behind it. And I thought we are supposed to get warnings when there are 10 seconds left and we didn't get that.
And you
Okay, so
can't
you
touch
should.
just 20 seconds.
Yes.
It's
You
too
should,
long.
you should. Sorry, you can't do what?
It's too long.
Okay, I
for
would
20
like to know
seconds.
if it's not a calculatable thing, then the logic and also why we weren't given a warning of 10 seconds like before.
Okay, the warning of 10 seconds. Maybe the timekeeper forgot, but you're supposed to also time yourself. Within mind, you should time yourself as you're calculating. Of course, 20 seconds are too short. Then secondly, the moderator can show us the workout for the question. But I can tell you that it's workable within 20 seconds. It has been worked out before. It's not a new question, and it has been worked out before in the 20 seconds. So, moderator,
Yes, thank
let
you
me
very
have.
much, sir. Concerning the issue that was raised by Makerere, if you say that the question was long, then it's really in your advantage because it means that your time does not start until you end the reading of the question. So you saying that the question is long is in fact in your favor because you get to see the question, you get to read it, but the time does not start until the quiz master is done reading it, and all of that time is calculated into how fast you're expected to answer the question as well. I hope you understand that.
Yes, thank you.
Like he said, this is a question we
you and
the questions, and this is the question that is solvable in 20 seconds. But thank you for raising your concerns.
Really not
Yeah,
fair.
thank
Okay, they're working either way.
Okay, thank you very much, moderator. Mumsa, hold on. Thank you, moderator. All these questions were worked out and tried to ensure that they are standardized and they can be answered within 20 seconds. And secondly, the question being long actually gives you time because I'm going to be reading. I'll take my time reading. Well, for you, you can do your quick reading and then calculation. Immediately I finish reading, that's when the timing begins. So it should be in your favor. But anyway, we shall try. Maybe next time we shall bring shorter questions, Mumsa. Moderator, they wanted you to show them the working. You can maybe work it out in a longer when you have time, Mumsa. Any other concerns?
Well, unfortunately, that won't be possible for this round. But
But then how are we able to ascertain that that's the right? No.
It is Mumsa, it is the right answer.
I'd like to see the working.
Mumsa, it is the right answer until you prove us wrong.
We just want to
It wasn't
we just want to know how the answer was gotten. We choose another question because this was
Sorry about that, Mumsa, but remember the quiz master's decision is final. The correct answer is 2,250. And that's the correct answer, unless if you have a working and you prove it otherwise. We may not have enough time to prove that. Yeah, time may not allow for us to prove. Okay, thank you very much. Back to you, score recorder, to tell us the final scores.
Okay, I'll share on the screen now. Please give me 1 minute. Can you see my screen?
Yes, we can see that.
Okay. So this is from the first round, from the general knowledge. This is from the preclinical. Should I continue?
Yes, please.
Okay. So this is from the clinical part. If you have any issues, you can raise up your hand.
You raise them.
Okay. For the math logic, I got disconnected at a point, so I couldn't
So
record all of
math and logic, I can let me read through and see if they confirm. You see, Uganda Christian University passed one question.
Okay.
Do you affirm that UCU?
Yes. Yes.
Then MUMSA passed one question.
Okay.
Then Malawi also got one question correct. Namdi Azikwe got one question correct. Ambrose Ali University got one question correct.
Yeah, it's just Soroti that remains.
Yeah, Soroti did not get any question correct. They failed all their questions.
So that so for I think for the first round, for the general knowledge, we have Uganda 5, MUMSA 5, Malawi 5, Naumsa 5, Ambrose 10, Abumsa 5, and Soroti 10.
That's
then
correct.
For UC Uganda, we have 10.
Yeah, this preclinical.
MUMSA,
Yes.
we have 10. Malawi, we have 5.
No, MUMSA has 5.
Okay, just 5.
Mm.
Okay. 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 So Namdi 5, Ambrose 0, Abumsa 5.
Ambrose is 5. Ambrose is 5. We don't get you.
Ambrose has 5. It's okay, Ambrose. I have your back. You have 5. I recorded them.
Okay.
Ambrose has 5.
Ambrose 5, Abumsa 5, Soroti 5.
Abumsa 10. Oh, Abumsa 10.
Abumsa 10. Ahmed Bello 10.
Soroti is also there.
Soroti also 10.
Okay. Abumsa Ambrose 10, right?
Yes, Ambrose 10.
Ambrose 5. Abumsa 10.
Oh no, Ambrose 5. Ahmed Bello, Abumsa 10.
Okay.
And then Soroti 10.
Soroti 2 10. Okay.
Soroti 10.
Okay. So for the clinical part, Uganda 5.
Yes.
Malawi 10.
Malawi 5. Uganda, UCU 5.
Okay.
MUMSA
5.
Okay.
Malawi 10.
Yes.
Namdi 5.
Yes.
Ambrose 10.
Yes.
Abumsa 10.
Yes.
Then Soroti 10.
Yes, that's correct.
Okay. Uganda 5.
Yes.
5. Malawi 5.
Yes.
Namdi 5. Ambrose 5. And the rest 0. So
yes.
So that's the
and then give us the total scores.
Okay.
Final scores.
Final scores. Okay, so let me add it up. Sorry. Okay. Okay. Uganda 510 5. Okay. Five, 10, 5.
Give us time.
5. Okay. Okay. So sorry. So for Uganda, we have 25. Five.
If you don't mind, I can help. Can I help you score recorder?
Yes, sir.
So you see is 25.
Yes.
Mumsa 20.
Yes.
Malawi has 20.
Okay.
Then Namdi Azikwe has 15. Namdi 15.
Malawi 20.
Malawi 20. Namdi has 15.
Okay.
And then Ambrose Ali has 30.
Okay.
Ahmed has 30.
Okay.
And then Soroti, which one next is Soroti has also 30.
Okay. Thank you, sir. I really appreciate it.
Thank you. Welcome. Which one is missing? Ahmed, we said, okay, I can repeat for you. Ambrose, 30. Ahmed Bello, 30. Soroti University, 30. UCU, 25. UCU MSA, 25. Mumsa, 20. Malawi, 20. And Namdi, 15.
Yeah, I get it. So you can help me to confirm from my side if I got it right.
Yeah, okay.
I will make a more clear table when I'm settled because I have issues here, but please bear with me. But this is the final score. I don't know if you can help me to confirm, sir.
Let me confirm. Yes, these are the final scores. Those are the final scores.
Okay. So that means Ambrose, Ahmed, and Soroti are on the same line, followed by Uganda, then Mumsa and Malawi are on the same score, then Nnamdi. Am I right, sir?
Yes, you're right. Mumsa and Malawi have each 20.
Yes. Ambrose, Ahmed, and Soroti have 30.
Have
Then
30, yes.
Uganda has 25.
Yes.
And Nnamdi has 15.
Nnamdi has 15.
Okay. Does anyone have issues?
Anyone with a complaint?
Okay. So I think the moderator. What's next? Should I stop sharing my screen?
Well, Ambrose Ali is complaining the quiz master was writing. If you want my transcript, I can give it to you. I was recording, so I have all. You can see that I was telling the score recorder what where she messed up in case of network. I have all your scores, so no one is telling us the scores. Yes, unless if you have any issues, Ambrose Ali University, you can tell us. Anyone having concerns about the scores? Anyone whose scores have been deducted, or whom have we given more scores? Okay, no issues. No one has any issue. So moderator, back to you. It is up. The powers are upon you to announce who goes to the second round and then who tries again next time. So you've seen Nnamdi, I think, had issues with their network, and that is evident in their performance. They have not performed very well because of network issues, and here plus the others. So maybe next time better. Make sure you get the best network. Back to you, moderator.
I think
Yes,
the moderator.
thank you very much, Quizmaster. Okay, score recorder, can you please display the scores again?
Okay.
The final scores.
Sure, it's loading.
No problem, no problem.
Okay. So here's the final score here. Can you see the final scores?
Okay, yeah. It's clear. Okay, so from what we have here, the top 4 MSAs are Ambrose Ali, MSA. Is what MSA is Ahmed? Do you mean Amadou Bello?
Yes, Amadou Bello, sorry.
Yes, please.
Okay, Amadou Bello, MSA. Soroti University, MSA. And Uganda Christian University, MSA. So those are the 4 MSAs that top the Group 1 preliminary stage and qualified to the and are qualified for the semi-final stage. So congratulations to Ambrose Ali, Abomsa Soroti, and Uganda Christian University MSAs. So there'll be we are going to release the final score, we'll release a flyer to show the MSs are qualified from the preliminary stage. So it will be available publicly. So Quizmaster, are there any other concerns?
No, thank you very much, the organizers, and I want to congratulate Ambrose, Ali, Ahmed Bello, Sorot University, and the Uganda Christian University for making it to the semifinals. And I would encourage the others to, come and participate next time. So let's keep up the spirit. This is just, they're just two questions, so it may not give a clear picture of who has performed what. But for now, we take the other four. The others who didn't make it, maybe work on the issues that we had so that we can compete better next time. From me, I think that is it. Thank you very much for giving me this opportunity to be part of the FAMSA quiz.
Yes, thank you very much, sir, for being the quiz master for this session. So the moderator, are you back, Miracle? Are you here? So I can hand over to you. Okay, things Miracle might be having some network issues. So the first four MSs will meet again at the semi-final round. That will be as scheduled. I think that should be next week, Saturday, for the first semi-final round. And well done to everyone, and congratulations to the MSs that qualified. So this brings us to the end of the Group 1 preliminary stage. And I congratulate again the MSs that qualified, and I also thank the other MSs that will be leaving us at this stage for their sportsmanship and their cooperation throughout the quiz. So thank you everyone for coming out, for joining in. We'll see you again next time.
Thank you.